Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious disease, hepatology, and gastroenterology. Our topic today about syphilis. Syphilis is a bacterial infection, usually spread by sexual contact. The disease starts as painless sore, typically on the genitals, rectum, or mouth. Syphilis spreads from person to person via skin or mucous membrane contact with these sores. After the initial infection, the syphilis bacteria can remain inactive in the body for decades before becoming active again. Early syphilis can be cured, sometimes with single shot injection of penicillin. Without treatment, syphilis can severely damage the heart, brain, or other organs, and can be life-threatening. Syphilis can also be passed from mothers to unborn children. So, they about three stages of syphilis: primary syphilis, secondary syphilis, and tertiary syphilis. So, as regard primary syphilis, this stage is the earliest stage, and the stages of syphilis may overlap, and the symptoms do not always occur in the same order. You may be infected with syphilis without noticing any symptoms for years. Primary syphilis, the first sign of syphilis is small sore called chancre. This sore appear at the spot where the bacteria entered your body, while most people infected with syphilis develop only one chancre. Some people develop several of them. The chancre usually develops about 3 weeks after exposure. Many people who have syphilis do not notice the chancre because it is usually painless, and it may be hidden within the vagina or rectum. The chancre will heal on its own within 3 to 6 weeks. Secondary syphilis, within few weeks of the original chancre healing, you may experience a rash that begins on your trunk but eventually covers your entire body, even the palms of your hands and the soles of your feet. This rash is usually not itchy and may be accompanied by wart-like sores in your mouth or genitals area. Some people also experience hair loss, muscle aches, a fever, or sore throat and swollen lymph nodes. These signs and symptoms may disappear within few weeks or repeatedly come and go for as long as a year. Latent syphilis: if you are not treated for syphilis, the disease moves from the second stage to the hidden latent stage when you have no symptoms. The latent stage can last for years. Signs and symptoms may never return, or the disease may progress to the third or tertiary stage. Tertiary stage of syphilis: about 15% to 30% of people infected with syphilis who do not get treatment will develop complications known as tertiary syphilis. In the late stage, the disease may damage the brain, nerves, eyes, heart, blood vessels, liver, bones, and joints. These problems may occur many years after the original untreated infection. As regards neurosyphilis, at any stage, syphilis can spread and, among other damage, cause damage to the brain and the nervous system and the eye. As regards congenital syphilis, babies born to women who have syphilis can become infected through the placenta or during birth. Most newborns with congenital syphilis have no symptoms, although some experience rash on the palms of their hands and the soles of their feet. Later, signs and symptoms may include deafness, teeth deformities, and saddle nose, where the bridge of the nose collapses. However, babies born with syphilis can also be born too early, may die in the womb before birth, or can die after birth. So, as regard if the patient suffer from any rash after sexual contact, he must go to the doctor and to be examined. As regard the spread or the causes of syphilis, this bacteria is called Treponema pallidum. The most common way syphilis is spread through contact with infected person during sexual activity. The bacteria enters the body through minor cut or abrasion in the skin or mucous membranes. Syphilis is contagious during its primary and secondary stages, and sometimes in the early latent period. Less commonly, syphilis may spread through direct contact with an active lesion, such as during kissing. It can also be passed from mothers to their babies during pregnancy or childhood or childbirth. Syphilis can not be spread by using the same toilet, bathtub, clothing, or eating utensils, or from door knobs, or swimming pools, or hot tubs. Once cured, syphilis does not return on its own. However, you can become reinfected if you have contact with someone syphilis sore. As regard risk factor, you face increased risk of acquiring syphilis if you engaged in unprotected sex, have sex with multiple partners, are men who has sex with men, are infected with HIV and the virus that causes AIDS. All this may lead to risk factors. So I will leave my WhatsApp if you have any question, or if you want to send medical report. My WhatsApp is 00201 027284778. I will repeat it again. As regard my WhatsApp, 002010272847778. Thank you very much.